Welcome back to the BirthLink podcast. My name is Colette Wickholiker. I am a labor and delivery nurse turned educator, birth coach, doula. Montrese maybe next. Yes, why not? I'm looking into it. I've had a crazy week. I hope you had a really great week. And I have been really looking forward to releasing this episode. I have Emily Guarnotta on today. She's Dr. Emily Guarnotta. She's a licensed clinical psychologist and certified perinatal mental health provider. And she specializes in maternal mental health, right? This is a big, big topic. I think we just finished up Maternal Mental Health Week, Awareness Week, though I think, I love those weeks and days, I guess, because it brings to our attention. But I hope we don't stop continuing to bring awareness to it, even though it's not the week or the day or whatnot, right? So sometimes you won't see me post about those things because I'm like, I'm doing it constantly, guys. I'm doing my best, but here and there. But mental health is a big, we need to use preventative measures. We need to be aware. We know how to assess situations and how to support each other and ourselves, what to look for, what our partners should know. And we get into all of that in this episode in a way that actually opened my eyes. The way she explained things, especially when it comes to postpartum rage and anxiety, intrusive thoughts. I asked all the questions, guys, and I learned so much. I really did. And I think you will too. All right. She's a therapist that in a practice is called Phoenix Health that supports parents all over the United States. It's basically virtual. So make sure you join her you can write her at emily@joinphoenixhealth.com. And you can go to her website, joinphoenixhealth.com as well, or find her on Facebook, Join Phoenix Health. Okay, let's get into the episode. I can't wait. I've been waiting for this for a long time. If you know me, you know that I've been going through a lot of issues with my mother, dealing with anxiety and depression, and maybe undiagnosed from postpartum, and I'm 45 years old. So what's happening with her? I don't know. Maybe if she got support and knew sooner, this wouldn't have happened later in age. She's 78 today. So I learned a lot that I can actually take and use with my own mother. And I hope you do too. Someone somewhere, if it's not you, someone you know is probably going to benefit from the knowledge that you have. So don't forget to share this episode, subscribe, go to my Instagram at My Friends a Nurse and like and follow me and message me. And let's start that community of support. All right, let's get to the episode. Enough of this chit chat. Welcome to the BirthLink podcast, presented by My Friends a Nurse. I'm your host, Colette Wickholiker, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of 2 beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. Hey, Emily, welcome to the BirthLink. I'm so happy that you are here to join me today.
Thank you so much for having me.
Oh, you're so welcome. Thank you so much for coming. So I gave a little intro already about who you are and what you've done in this space. But please, I want to hear from your own mouth. How did you get to where you are in the mental health space with women in mind, right? Tell me your story.
So I'm a psychologist and I'm also a mom of 2. And I was working as a psychologist before I ever got pregnant or had my first child. And prior to having her, I was aware of what perinatal mental health was and the stats on postpartum depression and anxiety. But I was really naive in thinking that it would never happen to me because I was a mental health professional. It sounds so ridiculous in hindsight, but that's honestly, truly what I thought, that it was preventable. And then after I had my first child, I was really blindsided by postpartum depression. And it took me a really long time to even admit that's what it was. I kind of knew, but actually saying it out loud and then finally like making the phone call and seeking help and getting a therapist again took me a really long, like probably she was about 8 months old before I was even willing to pick up the phone and seek help. And that whole journey of going through postpartum and then recovering from it myself really made me realize like if I went through that, even with my background in mental health, like so many people are experiencing this and feeling blindsided and having trouble admitting, not knowing where to get help. So I really that led me to want to go back and learn more and respecialize and really dive into this area.
Yeah, I find so often when I have these conversations that is own personal experience that leads us to dive in more on educating ourselves around the maternal space and things like postpartum depression or some more physical symptoms. And speaking of that, can you tell me just like what were, if you we can get a little more personal, what were the symptoms that you noticed and what really led you to finally say that's enough?
For me, I really realized postpartum depression and anxiety, really any perinatal mental health condition can really present very differently from person to person. For me personally, it was a lot of sadness, a lot of hopelessness, this sense of like my life is over or it's never going to be the same again. There was like a lot of fear that I would never feel like myself again. It was a lot of guilt and it was a lot of irritability too. And irritability, I think, is a symptom that not a lot of people realize is a symptom. And it's actually in the diagnostic manual for depression and anxiety. But when a lot of people are feeling irritable postpartum or during pregnancy, they often think that they're just not a nice person or they're hormonal, but it really is actually a symptom of these conditions. So that's one of the ways that it really manifested for me. And then often that can lead to, conflict in your relationships too, if people don't understand that that's a symptom and taking it personally. But it was a lot of depression for me, just a lot of hopelessness, sadness, and dread.
Yeah, I'm so sorry you had to go through that. It is unfortunately common these days, and it is good that we're becoming more aware of it. What was the support like when you finally reached out?
So when I finally reached out, it took me a long time to take that step, and this was actually pre-COVID. So telehealth really wasn't an option at the time. So that also factored in the thought of commuting to an appointment, sitting through an appointment, coming back. It felt so overwhelming, either schlepping my baby there and having her there with me or having to arrange childcare and then feeling guilty that I'm taking that time for myself. So that definitely played a part. I really wish telehealth was an option at that time. And when I did finally reach out, I ended up seeing a therapist who didn't
Eh,
really specialize in this area. And for me personally, it was a little bit tricky because I think that she didn't always understand the kind of the nuances of what I was going through, and for me personally, it wasn't a great fit and it wasn't really working, so I actually had to take a step back, and I gave myself a little bit more time, and a couple months later, I decided to reach out for help again, and then I actually was able to find a therapist that I connected with, and I actually still meet with her to this day. It's been like 6 or 7 years, but it was a little bit tricky in the beginning to find the right person. So I really encourage people, like, if you're not clicking or it's not working on the first try or even the second try, like, please don't give up because that person that you are gonna click with and that is gonna understand is out there.
Yeah, and it's good that the telehealth option is becoming more available, and it makes it a little easier probably to switch. But you're absolutely right. You you're probably not, it's kinda like dating. You may not click with the first person, and don't give up. Like, don't say, "Oh, it's not gonna work for me," because it is a very personal type of relationship. Like, you're sharing things, and if they don't mesh, if they don't have the same beliefs or
Mhm.
they're coming in with their own experiences, they may be great for someone else and maybe just not you. But if you're suffering, if you are, or even if you're questioning if you're in denial maybe, or you're just like, oh, I don't know. But if you're suffering, if you're not happy, if you're not enjoying life, then find out if it's something that that is a little deeper and that you can get help with. So, when was the decision made then? I want to know more about your journey into your professional life when you took that step to start working with women during this stage.
Yeah, I think that came a couple years after I healed from my own postpartum depression. I really needed to take a minute to focus on me and just get myself well again. And the whole transition, this around the time that I actually reached out for help was when I was transitioning back to work. And that was for me personally, that was extremely stressful transition going back and being a working mom and figuring out how to juggle all of that. So I really needed to take a minute to figure out how that was all going to fit into my life. And I started my daughter was probably like 2 when I started taking more classes and learning more about perinatal mental health. And that coincided then with me having my second child. But by that point, I was already established with my therapist, and telehealth was an option because it's during COVID. And I have to say that made a world of a difference, like having that built in support, knowing I had that appointment scheduled like a week after I gave birth was such a drastic difference from what I went through with my first. So if you can set up care before your postpartum, I think in a lot of cases, it's just going to make the transition a bit easier. It's really hard to kind of start that process after. Definitely not impossible, but it can make it a little bit more challenging.
Yeah. Even if you don't normally suffer from depression or anxiety and you don't, no, I'm fine. I have no problems with that. Like it'll be great. I'm sure that's where you were at. There are women that have, a history of chronic depression or anxiety that already have established therapists so that they can manage that. But sometimes it's the women that are just simply okay, or they've been fine before their pregnancy and they don't seek out that help until months after, 8 months after, sometimes a year after, right? Because they're just, it's not going to happen to me. I was fine before. Like, I just got to get through it. And that being said, what do you find? You've been working with women for the past, maybe like 4 years, I think you said. What do you find to be the main reasons why they wouldn't reach out? For those women that are listening right now, that are thinking like, no, I'm just going to listen to this, but maybe, what would you say to them? What are the things that you find most women, I want to say excuses, but reasons why they wouldn't
Mhm.
reach out to you, and how can we get past them?
I think shame is a big one. As much as we are trying to talk about perinatal mental health, I think for a lot of people, when you're in the thick of it, there can still be part of you that feels like it's weakness, admitting that this is happening to you and admitting that you need help. I would say, in my experience, that's probably one of the biggest ones. And we're really trying to shift the narrative on that, that asking for help is a strength, not a weakness, and help just makes you stronger. But I get when you're in the thick of it, it's really hard to believe that. And your support system plays a big role too. If you have people in your life that are very pro mental health and pro therapy, they'll probably be encouraging you to do it. But if you have people that maybe don't quite understand it or maybe have a little bit of stigma themselves, you might have that in your ear too, or feel kind of embarrassed or ashamed to admit to the people around you that that's what's happening. But no one should have to suffer. When we do have these options out there, and it doesn't have to be a long term thing. Like with perinatal mental health, there are sometimes people just come in for couple weeks or a couple months to address these symptoms and start to feel better, and then they kind of go on with their lives. And other people end up being in treatment much longer by their own choice, but it's not like a diagnosis that's going to follow you for the rest of your life. You're not going to have the scarlet letter on you.
Right. That's true. Shame, I think in society, we value independence a lot.
Mhm.
So we can do it on my own and I just need to push through it. And we have this picture of ourselves as what we're going to look like as a mother. And we're just going to like almost try to force ourselves to be that picture. And when it doesn't work out, it just gets worse. It just makes things worse and worse. And until we're like, I can't do this anymore. You had mentioned before about Phoenix Health, which is where you work, that accessibility is so important to you guys as well. That's why you're telehealth and you're well priced. What about that? Like if someone thinks like, oh, I don't have insurance or I don't have this, I can't afford it. How do you help them work through those hurdles?
Yeah. It's tough. Insurance in our country, the whole system, I mean, that's could be a whole episode or series of episodes
For
we could talk
real.
on that.
Yeah.
It's really hard. Personally in our practice, we really try to work with people as much as we can. We do take insurance and we do try to work with people who don't have insurance or who have high deductibles. But there are options out there. Postpartum Support International is a great organization and they have a great program where you can actually contact them and they'll connect you with one of their local representatives who's really well versed in local resources, and they can help connect you with someone in the community who either takes your insurance or can work on a sliding scale. So if you're having trouble finding something that's affordable, that's a great option to go through, and they'll do some of the legwork for you, which is often like the hardest and most overwhelming part of it.
That's amazing. Thank you so much for that resource. I'll leave that in the show notes as well. So if you missed it, you can just go to my show notes and get more information because I mean, it's insurance is so tough and it kind of limits our choices, but that's not to be said that us as a community, as a country, aren't trying our best to support each other. It just sometimes you got to dig through to find it. So, and sometimes that's a lot of work. So, finding advocates and finding resources that can help you do that is so vital and just asking for help. So, if you have a sister or a friend or your partner that, like, look, I'm going through a lot, can you just look this up and give me? Sometimes you need some help or a little push and to find the right places. What is going on in your community? It just, for me, as I started getting into my friends a nurse and trying to build resources for my small community in California, in my little area in Simi Valley, I didn't had no idea what was available. Then there's a lot. Like there's actually a lot. Is it the best? Maybe not, but if you sift through it, you can find something that can work for you until you get to a place where you can get what you need. And sometimes, maybe through Medi-Cal, like for here, California, Medicaid or government resources, you can find something. So I think accessibility, like these are just hurdles, right? But they're not walls. They're, there's really nothing that should stop you. And then of course there's so many examples in education on social media. If you look at the right places that can help us, what do you think how do you think, I know this is like kind of side note, but it just came to me like, how is social media affecting us postpartum these days? I just want your opinion, your take. Like, is it good? Is it bad? I know this is probably a whole different conversation too, but I feel like scrolling and seeing all this stuff, it can either be really great or really detrimental. I'm just curious your opinion on
Yeah.
it.
I see a lot of scrolling happen postpartum. I mean, if you're nursing or feeding your baby and it's a lot of time by yourself. And when you don't have things to do with that time, or you're not used to having that much time where you're home with a baby, like a lot of scrolling will happen. It I'm sure there are cases where it's positive to a certain extent where you can get some valuable information, but I think in a lot of cases it ends up being negative because it's really information overload and not all the information you're being served is necessarily accurate or helpful. I always try to remind my clients you are being marketed to on social media, so please keep that in mind. You can't necessarily take everything that you're seeing at face value. And of course, it is always, the highlight reel. So please keep that in the back of your mind that the person who looks like they have it all together, you certainly don't know what went into taking that picture or making that real. It's can really be a false sense of reality. So I really encourage people to constantly evaluate your relationship with social media and ask yourself, is this helping me? Is it serving me? Is this not helping me? And when it's not helping you to find ways to take that step back, like take a little bit of a break because it's tricky. It can definitely be a slippery slope.
Slippery slope, exactly. And just for me, like as my friend's a nurse, I was like, well, I want to get my name out there. So they're like, well, you got to post 6 reels a day and post this. And then I realized like I'm scrolling on there more than anything, trying to because now I'm like, oh, I need inspiration or I need to see what else is out there. And it's not good for my mental health. And I'm like, I don't want to be part of this problem. So it's like a fine line of educating. So we are out there. There's some of us out there that are educators, and we're giving you valuable information, and we're licensed and certified, and we've done the homework. But yeah, you have to be careful on social media about who you are following and the information that is being fed to you. And then what also are you looking at? Like, are you looking at examples that are making you feel good and encouraging, or is it making you feel bad and causing you more anxiety or stress? You got to just be careful with it. And I just wanted to bring up real quick social media because it's such a huge thing. I find so many of the moms are on social media and they're scrolling and scrolling. I'm like, I can't be good, and I don't
You're
I
in
don't
such
want
a
to add.
vulnerable time in your life
Yes.
too, so
Oh,
you
I
have to be really
know.
careful with what you consume.
Yeah, I want to touch, now that we mentioned that, on the new uptake on postpartum anxiety and rage, and your thoughts about. I've heard about postpartum OCD is now being thrown around. These are things that a few years ago, would not even come out of my mouth. It was like postpartum, when I educate patients at the bedside, postpartum blues, postpartum depression. Maybe we can talk about a little bit about the difference between blues, depression, and then now anxiety, rage, OCD. Like, how do we decipher? Do these words mean anything? You mentioned earlier, it's the symptoms are so different for everyone. But as a psychologist, how do you differ? How are women supposed to say, oh, this is postpartum anxiety or rage or depression, and how do we move forward with that? I know it's a lot, but let's touch on anxiety and rage a little bit and the differences.
Sure. So the baby blues are really its own thing. The baby blues are some emotional symptoms that happen between the first couple of days after you give birth to the first couple weeks. They tend to be very mild, and then they resolve on their own within a couple of weeks. You're still able to function through them, and they can come and go, but they're not chronic or present all the time. So there could be some sadness, a little bit of anxiety, maybe some difficulty sleeping, some irritability. But again, the symptoms are very mild and you can function through them. Postpartum depression and postpartum anxiety are actual perinatal mental health conditions. So these persist for several weeks. And the main difference between postpartum depression and postpartum anxiety is that the depression is more of a sadness and the anxiety is more of a worry or fear. And often these two occur together. It's actually very common to see people come in with both, but postpartum anxiety is actually more common than postpartum depression, which is kind of strange that we talk about postpartum depression so much more, but statistically, postpartum anxiety does show up more. With postpartum anxiety, again, the symptoms are often a sense of worry, a sense of fear. Often these worries and fears have to do with the baby, like something bad happening to the baby, accidentally or even intentionally hurting the baby. There's often a sense of feeling like really on edge, irritable. There can be difficulty sleeping. It can feel like you have trouble making decisions. You don't quite feel like you can focus on things. And you can also experience intrusive thoughts, which are these thoughts, images, or ideas that are really disturbing to you and are unwanted, but you feel kind of like you can't control. Some of the ones that you we talk about a lot are like that fear of dropping the baby or falling down the stairs. That would be an example of an intrusive thought.
I had those. I find most women, when they start conversating and talking about their postpartum period, have intrusive thoughts, right? It's like, but maybe it's like I had them, and it was just a few, like maybe I could count them on one hand, right? They're scary. They're like, why would I even think about running into the street right now? Or like I would picture the stroller just going and like I'm pushed it or something. It was awful. But then it would go away, and that was it. It was only a few times. But if you have those thoughts, because I feel like it is pretty common, how do you know it's just a few times, or like I should seek help?
That's a great question. So you're right. Statistically, we say about 9 in 10 women have intrusive thoughts postpartum, so they are extremely common. Yeah, the main difference between someone who has, I'm going to say the quote unquote normal or intrusive thoughts versus having a mental health condition is in the case of having a perinatal mental health condition, the thoughts are so upsetting or distressing that they impact your quality of life or your ability to function. And you mentioned perinatal OCD before. Perinatal OCD is when these intrusive thoughts happen so often and they're so distressing that in response to these thoughts, you take some kind of an action or do something, whether it's physically or even mentally in your head, to help relieve the anxiety of these thoughts. So, for example, you have a fear that you're going to fall down the stairs and you do maybe a counting ritual in your head, or you avoid the stairs completely. That would be an example of a compulsion. And then these obsessions and these compulsions get so bad that they start to kind of run your life and take up a lot of your time.
That was very well explained. You're very good. And then what about postpartum rage? I'm only bringing this up because I know a few close people, like people close to me that suffer with that. And they're popping, maybe it's because I've entered this space. I'm hearing it more and more. Are you finding that it's becoming more common? And what can we do about that?
Yeah,
Or
I think
suffering?
it kind of goes back to earlier when we were talking about the irritability. A lot of people don't realize that that's a symptom of depression and anxiety and other mental health conditions. And when you feel so overwhelmed by something, you are kind of primed to get really have these overreactions or go into a rage when you're just feeling so overwhelmed and then maybe your partner does something that's upsetting or isn't supportive in a certain way or someone else in your life or something happens or your baby won't stop crying, whatever it is. You're just so emotionally taxed and depleted that you feel like you just can't. Whereas normally you might take a breath and kind of talk yourself down from the feeling and be able to respond. You're so taxed that you can't do that. So you just kind of react to it. And I think people are talking more about this now than they were in the past, which is so important because it's not that you're a bad mom or a mean mom or a bad person. It's that this is actually a symptom. And that's what we really want to let people know. These are symptoms. They're not personality traits.
Amazing. Okay, that makes so much more sense. The irritability part and then just the triggers that we may have and who is around us and how are they responding. Yeah, I could find myself raging. I know you're going through hormonal changes as well and then probably sleep deprived. How does sleep play a role in our mental health? I want to touch on just how important sleep is and what role it plays.
Yeah, sleep is huge. I mean, we know just outside of postpartum and perinatal that sleep deprivation increases your risk of a lot of physical and mental health conditions. So, when you're sleep deprived with a newborn, it's just that much harder to really function and to navigate all these thoughts and feelings that you've had. Whereas, maybe when you do have a good night of rest and you have an intrusive thought, you might be more likely to be able to kind of talk yourself through it. But when you're sleep deprived, you're just again more depleted, taxed. It's going to be that much harder to be able to show up for yourself in the way that you want to or the people around you.
Yeah. So first thing is just the baseline of, good nutrition, getting outside and getting sleep, like the basics, changing your clothes and clean clothes, whatever you have to do to maintain that baseline and then work from there. Find a therapist while you're pregnant so that they can find you at baseline as well and you're prepared for that period. Really great preventative things that we can do in that space. And made it so clear to me the postpartum depression and blues and anxiety and rage that I know a lot of people are going to really respond well to that and probably understand a little bit more. I've asked a lot of people. I think this is one of the best explanations. So thank you. Can you leave us before we close? It's just something that you can speak to our audience about that they can maybe that you want to share, that you just want to affirm, or a tip, whatever you got in your head. I'm kind of putting you on the spot, but what do you got?
Yeah, I mean, if I could take one thing from my personal story is just don't wait. You know yourself, and if you're not feeling right, there's always going to be things that reasons why you shouldn't do it now. I don't have the money. I don't have the time. I'm embarrassed. There's always going to be these barriers that show up. But once you really address what's going on, you're so much more likely to feel better, and like there is light at the end of the tunnel. So just please access the resources, access the help. And if you reach out to someone and they don't take your insurance, or they're not available, or whatever it is, there's another barrier, just ask them, like, can you point me in the direction of where to go from here? I'm having a lot of trouble. Personally, I always try to do that when people reach out, and if I'm not able to help them for whatever reason. But if you're faced with a situation where it's just barrier after barrier, just like, ask, let them know that you're really struggling to find the help, and hopefully that person will take that extra step. And like I mentioned, Postpartum Support International is a great organization. They have free online support groups. They'll connect you with local resources so that you don't have to do all the digging yourself. And they just have so many resources. So definitely check them out. And yeah, just don't delay it. Seek the help.
I love that. And then tell me, just before we leave, a little bit about Phoenix Health and your availability. I know you're in many states and do virtual. Tell me a little bit before we close.
Yeah, so my practice is called Phoenix Health, and we provide virtual care in most states across the country. And myself and all the providers on my team, we all specialize in perinatal mental health. And we work with families that are navigating everything from infertility, pregnancy, postpartum, postpartum, pregnancy loss, the whole spectrum of perinatal mental health. And we also take insurance. So our mission is really to make the care affordable and accessible.
Perfect. Okay. And then we can find you on Facebook and Instagram at _Phoenix_health. And you're at Dr. _Emily _Guarnotta. Did I say that right? No, probably not. Guarnotta? I did? I butcher names a lot. I'll leave all your information in the show notes as well. Emily, thank you so, so much for joining me today. I really enjoyed this conversation, and I feel like I have learned a lot, and I know our listeners have as well.
Thank you.
Thank you. Bye. All right. Like I said, I learned a lot of things on this episode today with Emily. And again, you can find her at Join Phoenix Health on Instagram, Facebook, joinphoenixhealth.com. It's all in the show notes, guys. Go check it out. You can find me on YouTube as well at the Birthlink Podcast. And you know where to find me on Instagram, guys. Until next week, have a good one. Bye. Thank you for listening to My Friends and Nurse presents the Birthling Podcast. We hope you enjoyed today's episode and found it valuable. Before we go, a quick reminder. The information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please subscribe, leave a review, and share it with your friends. Your support helps us reach more people and continue to bring you great content. Until next time, stay healthy and stay informed.